How do persistent and transient HPV infections differ for cervical cancer? Imagine your body as a busy city, constantly fighting off invaders. Human papillomavirus, or HPV, is one such invader that can sometimes cause trouble in the cervical area. But not all HPV infections are the same. Some are like quick visitors, while others stay longer and cause more concern. Understanding the difference between these infections is key to knowing how cervical cancer can develop. Most HPV infections are transient, meaning they come and go. When someone gets infected, their immune system often clears the virus naturally within about 2 years. In fact, around 80 to 90% of HPV infections are transient. During this time, the virus does not integrate into the DNA of the cells in the cervix, and the infected cells usually return to normal without causing any lasting damage. Younger women tend to clear these infections more easily, and the immune system is often effective at eliminating the virus before it can cause any serious changes. However, some infections are persistent, meaning they stick around longer than a year. These long-lasting infections are more concerning because they are often caused by high-risk HPV types, especially HPV-16 and HPV-18. When the infection persists, the virus can integrate into the host cell's DNA, which can lead to continuous production of viral proteins that interfere with normal cell functions. This disruption can cause the cells to grow abnormally, forming precancerous changes called cervical intraepithelial neoplasia. If these changes are not detected and treated early, they can progress to invasive cervical cancer over time. The longer the high-risk HPV infection persists, the higher the risk of developing serious cervical issues. Studies show that women with persistent infections are much more likely to develop high-grade lesions and, eventually, cervical cancer. The immune response in these cases is often less effective, and the virus can manipulate the environment to promote its survival and the progression of abnormal cell growth. This understanding is why regular screening and vaccination are so important. Vaccines help prevent infection with the most dangerous HPV types, and screening tests like Pap smears and HPV tests can detect persistent infections early. Early detection allows for treatment before the cells become cancerous, saving lives and reducing the burden of cervical cancer worldwide. In summary, transient HPV infections are common and usually harmless because the immune system clears them naturally. Persistent infections, especially with high-risk types, are the main cause of cervical cancer because they can cause lasting changes in cervical cells. Always consult healthcare professionals for personalized advice and screening options. Staying informed and proactive is the best way to protect yourself from cervical cancer.